Notifications are dumb and they probably aren't working. So I'm gonna sing my song. 'Cause it's dumb. Yesterday was the most cogent and being able to kind of get my mind going and not hurting as much day I've had in a few days. So, an update about, I would say, back in December, I was going through a lot, and there was a lot of upheaval in my life. People moving away, family members having trouble, serious health issues, and then I was having some health issues, and then I was having some mental, stresses and issues too. And I was very confused, and I kind of have almost like a body dissociation issue where I really sometimes will struggle and kind of wrestle within myself. Am I really sick or really injured, or am I actually having problems? And so I would say probably around December, January, February, around that time, I was having like all this side pain, and I thought, oh, this is just stress. This is just anxiety. I'm crazy. And yes, you can poke me with a stick and confirm that I am in fact alive. So I was thinking, I'm having all this side pain, maybe, and I would kind of toss and turn. I'd make a joke like I'm dying of cancer, or I thought maybe it was breathing related to asthma, and when I took a deep breath, it was hurting, and I thought, oh, maybe it's that, or I thought, oh, maybe it's an ulcer, and I'd talk myself out of, like, this is actually something serious where I should go see a doctor. And it was my friend Renee that said, hey, I think you might have a gallbladder issue. And I was like, yeah, that's an interesting thought. Anyway, it probably is cancer and I'm going to die. And I'd kind of waffle between worst case scenario and like, oh, this is an ulcer. This is just stress. This is just me being crazy. And I hung on with this, having these issues off and on until about April. And then April, oh, yeah, he ignored it till he bursting it. That's bad news. There's a lot of stories about that. So I held on to this about April, and I thought, okay, I'm having this side pain, but now it's in my chest. And so I was having these chest pains, and I have anxiety. And so if you've ever had a panic attack, there is like a heaviness in your chest or a tightening of your chest and shortness of breath, but it wasn't like that. It was worse. And it was almost like a description of a male heart attack. So I was like, oh, geez. So I'm like, I'm dying. So I'm like, I go to the ER, because with chest pain, it's like you can't play with that, right? And so you go to the ER, and I spent 8 hours in the ER, and they're like, yeah, congratulations, you have not had a heart attack. So, I did an EKG, did blood test, not a heart attack, but it felt like one. And they diagnosed me with Costco chondriitis, which means you are shopping at Costco far too much and you need to stop. No, just kidding. It means inflamed cartilage. So then I got this inflamed cartilage thing, and then I go to my doctor. My doctor's like, she starts poking around at me, and she's like, so you've had side pain. You thought maybe it was related to your asthma, but I don't think so. And so she starts poking around, and she hits like right below my right boob into my rib cage, and it's like, ah. And it's like, winner. And she's like, that's your gallbladder. And I said, are you sure it's not my liver or my pancreas? Because, they're all connected, right? And because, worst case scenario, freakouts. I knew it was too high to be my appendix, because everybody says appendix, shows up lower and then kind of moves center. And so I was like, Oh God. So I went for an ultrasound. It took forever to get in for one because it's overcrowded in our hospitals here in San Diego. Go to an ultrasound, and which was fine and dandy, except when she went over my rib area. I mean, she went everywhere, but the rib area for some reason is super tender, and it's that costochondritis, inflamed cartilage all around and stuff, and it just super angry. And I'm like, ugh, and then sure enough, I have gallstones where they're not supposed to be, and well, I don't even know if they're supposed to be, period. But one was partially blocking, and then my gallbladder was angry, which means inflamed. I just call it angry, and then then it kind of trickles down, and it's like its neighboring organs start getting angry too, because the pancreas is like, I'm pissed off too, because all this stuff is happening around me, and you just have tremendous side pain, and it just gets worse and worse and worse. And so what's happening is I was feeling, they said, oh, you can control this with diet. So I cut out like all red meat from my diet. I cut out cheese from my diet, all dairy from my diet, all butter from my diet. And I started, and I already eat like a toddler as it is. I'm a really picky eater. And so I'm barely eating anything that's like on the approved list. Like it's like 2 items. It's like I had apples and chicken today for the 19th time in a row. Like, so I changed my diet thinking, oh, this will work, and it doesn't. And I still end up with attacks and pain and constant side pain and constant cartilage pain and stuff. So eventually they go, okay, we'll put you on the board for a gallbladder removal surgery because your gallbladder isn't working like it should. And the fear was that if I let it go, it'll eventually burst or it'll become necrotic, and that's all like way worse. And if it bursts or becomes necrotic, then it's going to infect other organs, and they have to clean out your whole abdomen area, and they have to do like an old-fashioned incision. And so I said, no, let's do this beforehand so I can get a laparoscopic surgery and get it done. So did a laparoscopic surgery. A month later, I had to wait a month, and it was a kind of a painful, tiring month. But got in there. I've never had major surgery before. I've only had like minor surgery. And so yeah, anxiety is high about it, but I was trying to kind of like a mantra say like, this is a very common surgery. And it is. It's like the appendix. It's extremely common, fairly routine. I kept saying that the doctor that I had was in his maybe like 50s, really steady-handed. Not, the guy that goes, oh, you should probably retire, or the new guy that's fresh out of school. Like that it's routine for him, and he's done like millions of them. And so I keep talking to myself going, this is going to be best case scenario. It's a best case scenario doing laparoscopic. It's a best case scenario with this being just a gallbladder issue, not like, oh, congratulations, you have a cancerous tumor, So I kept trying to kind of, say in my mind, like, this is a better, and so by the time surgery came, as much as I'm usually an anxious person, and granted, I've had great support from my good friends, but by the time surgery came, I wasn't as scared as I could have been because I had talked to like enough people. I talked to some people in the community about general anesthesia, and then I asked a lot of questions about that with, in conjunction with asthma. Is that going to be an issue? And I just felt very confident in the ability of my surgeon. So that was good. Going in, though, in the operating room, man, you feel pretty damn helpless. Like, there isn't a damn thing you can do. You are at these people's mercy. There is nothing that you are going to be able to do to save yourself except go, I have a good attitude going in. I have faith in you guys. and I mean, it's one of those things where you get wheeled in, and because I'm a little bit of a nerd and I like watched ER and Grey's Anatomy and stuff, I know some terminology, and I have some family in that industry. But it's funny because I don't think I've ever, I've never been in a operating room like that before ever, and it's crazy. It reminded me of Jiffy Lube. Like, things were hanging from the ceiling. I don't mean like the lights, but I mean like there were like tubes and stuff, and just access to anything you could imagine. Panels on the ceiling, and just like machines on the side and stuff. I have no idea what all that stuff was, but I felt like I was at a Jiffy Lube or something crazy. It was like the biomechanics of surgery, and so I remember making some jokes. My anesthesiologist was a good-looking man named Dr. Gray, and I thought that was hilarious, but I didn't make any Grey's Anatomy jokes or anything like that. I actually refrained, because I'm sure he's gotten it before. And then didn't even see my main surgeon before I was out. Like, apparently he didn't make a showing going, oh, I'll be your surgeon today. Like, he just showed up when I was gone, as far as I remember. Like, I may have forgotten. But yeah, like, the dude, like, he was talking to me. I was asking some questions. I was asking him about being an anesthesiologist and being just kind of like making really nerdy small talk with him. And then I was gone. Like, I felt really good. Like, I actually got kind of like, hey man, I had a little bit of anxiety, but now I feel really good. and then I was gone. And that was it. And then they had surgery for like 2 hours. I woke up in recovery. And then in recovery, I was like, really like, kind of like flashes. Like, I had no sense of time. Like, it was like my lights went out. Didn't even remember drifting to sleep. And I woke up really confused. So I'm in recovery room, which is a large room that's separated with like different patients and like several nurses everywhere and doctors. And I'm trying to come to, and I'm cognitive enough to know I had surgery, but I don't know where I am kind of feeling. It's like a weird, confused thing. And I think what was stressing me out is I felt like I couldn't breathe, even though like I had a mask on. I had a breathing mask on. They already had taken the tube out of my throat, but like there's this mask on me and it's giving me oxygen, yet for some reason I keep thinking like this is impeding me from being able to breathe. And so I remember trying to pull at it and take that thing off as if that would help. and then when I became more too, they kept trying to, can you say your name? Can you just do this? Can you do that? And I couldn't, because I was like, "Grr." And then they were like, dude, like, they're like, I know you can say your name. and that's when all of a sudden, like, I started to kind of get with it. And then it was the craziest thing. I went from like completely to a lot of pain. Like, I felt like I had been stabbed like 1,000,000 times, and somebody had taken a knife and just stabbed me in my gut. And then my back just started immediately cramping up, like the worst cramps ever, like you're giving birth or something crazy. And I was like, ugh. And so all I could manage to say was, ugh. And they're like, yeah, you don't feel good. And all I heard were the words fentanyl and something with a D word, and then all of a sudden I felt better. And then they asked again, can you say your name? And then suddenly I could. I was like, yeah, my name's Deidre, blah, 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 blah. And they're like, okay, good. And so then I could say my name, and they pumped me full of drugs, so I was less panicked, because what was happening was I was really panicked in the sense that I was trying to take control of the situation. I'm hurting, and I felt like I've been stabbed 1,000,000 times. My back is cramping up. I feel like I can't breathe, even though I totally can. And I'm pulling at my mask and stuff, and they're like, nope. And, they're kind of redirecting me. And so finally, when they gave me the pain medicine, I was able to be like, okay, calm down. And so then, not short after that, like, my husband shows up in recovery, and I'm like, oh, okay, cool. This guy I know. And he's like, hey. And this poor guy, he was scared of everything. Like, I don't think this was all real to him until the day of. And the day of, when he was trying to get the gown on, and he was trying to tie the knots. He was all like, this guy is a very dexterous, very hands-on, fix-it kind of guy that can fix anything, build anything. He couldn't tie a knot in my gown because he was just so nervous. He got really scared, I think, and he was trying to not look scared, but like I think it just kind of displayed there, and we're like, oh, uh-oh. So he saw me in recovery, and he looked relieved and happy and teary-eyed, and but I mean, to me, that all seemed like in a matter of like a few minutes. But apparently I was in surgery for 2 hours and then recovery for another 2 hours before my husband showed up. So that's crazy. Yeah, I got morphine for a while. They flipped it to there was fentanyl and morphine, and then for a while, for the first few hours, it was morphine for a while. And then eventually in the night, they think they just switched me to Norco, trying to lessen it. Because morphine's, like, helpful. Like, it gets rid of the pain, but it wears quickly. Like, it wears off quickly. It's crazy. But, yeah. So I spent overnight in the hospital not too long. And I have been recovering. A friend's been kind of helping look after me. And I've been kind of out of it for the last few days. Like, most of my days and nights have kind of merged together because I've been really tired. Like, I go through short walks and things that they tell me to do for recovery, like eat and take some walks. Oh, the constipation thing is like, everybody warned me about it, but they're not kidding. And you can't push. You can't push when you have abdominal surgery because of risk of ripping your sutures and internal bleeding and stuff. And so you have to take stuff so that, like, things move easily. And so when things started working again, it was quite a relief too. Yes, I just said that publicly. But yeah, everything's working now, thank God. No ridiculousness there. Whew. But man, what a ordeal. And so I was just thinking, like, that's just for your gallbladder. And best case scenario with it, like best case scenario means it's not ruptured, it's laparoscopically done. Imagine what it's like to have heart surgery. Holy crap. Like, it's got to be worse. So yeah, abdominal area and surgery in general, it's like, whoa, it's like super invasive, and it's so hard to set up and stuff. Like, there's a lot I can't do still. Like, I'm starting to feel better and come to, and I've weaned off a lot of pain medicine, and I'm on more like over the counter stuff, but I can't twist, like, just to do laundry. I can't do the twisting part of it. Like, to sit up, it's like I actually have to grab a pillow and, like, hold it against me so that things aren't jostling. If I cough, you know, the nurses tell you this: if you're coughing and you're needing to move, you grab a pillow, you hold on to it, and it gives your gut some support, and boom. So that is my surgery adventure. And I've had a lot of support from friends. I felt very confident in my surgeon. He really made me feel confident in him. And I really got to tell you that nurses are like a godsend. Like all my nurses, except for the male nurse. I'm actually going to be a sexist and say the male nurse was a little bit sometimes excuse me. The male nurse was a little bit sometimes frustrating for me. I'm like, what good are you? But even him, like all the nurses were fantastic. Very helpful, supportive. They listen to you. So I had everybody talks, well, not everybody, a lot of people talk ill of nurses, but my experience was extremely positive with the nurses. So good job, nurses. They're the backbone of hospitals, man. They're superheroes for sure. And yeah, so I'm feeling better. The male nurse was the only one that could find a vein when you're in. That's interesting. My male nurse was very unsympathetic to the pain I was in, and that frustrated me because I had another nurse tell me the opposite. So another nurse said, when you're in pain, tell me, because what's happening is when you're in pain, you start to take shallower breaths. And when you take shallower breaths, you're at risk of your lung collapsing. And because I have, asthma and stuff, they didn't want to mess with that. And in fact, they made me do a lot of breathing exercises and tests and blowing the tube and stuff. And so I told the male nurse, I'm like, oh, I'm hurting. And he's like, well, I mean, how much hurt can you stand? I'm like, oh, fuck you. We're in an opioid crisis. I'm like, oh, fuck you. Seriously? I don't care right now. This whole opioid crisis thing drives me insane because, all right, let me rant about that for a second. I've been on Norco before for medical issues, and I've quit Norco easily. It is not that exciting of a drug. I don't know. I mean, maybe people are chewing it and drinking it. Oh, I should make a trigger warning for people that are addicts. But unless you get more than 15, or if you are feeling lousy and you're mixing it with alcohol or something, I don't really understand how it's that big of a deal. It's not. And plus it's mixed with Tylenol, and Tylenol can kill your liver and kidneys if you take too much. So I'm just this is stupid. This oh my God, we're in an opioid crisis nonsense that particularly California is part of just annoys me, because I'm like, you want people to suffer because there's a few idiots or people that are abusers. I'm sorry, but I think I'm kind of the other way. I'm like, no, if I've had major surgery, just give me the fucking drugs. I don't care. This is stupid. Maybe it triggers some euphoria. I would say for me, it doesn't really. It makes my arms feel heavy. But I don't have a euphoria that much that I can think of. Oh, excuse me. The vomiting thing is, they gave me a patch to keep me from vomiting it. They put a patch on my, I've never seen this before. They put a patch on my neck, and it had something on it, and it kept me from barfing, because they didn't want me to throw up, because I have internal sutures, and that would be bad news with the heaving. Yeah. And then maybe that's the problem. We're missing out on the fun. No, I'm just kidding. Yeah, for me it doesn't induce an euphoria, so it makes me really impatient when someone tells me when I'm in a lot of pain to be like, oh geez. So really quick, if you want to look at the shift in attitude toward opioids in California, you can excuse me, I'm coughing. If you want to look at the shift of the attitudes, I would say in early 2000s, I worked at a place where I was normally in the office, but I had to help out in the warehouse, and I jumped off a work truck. Now everybody jumped off the work truck, so it wasn't that big of a deal, but the way I jumped off it, I jumped off of the work truck off the back and onto a lift, and the lift has an uneven ground part, and so what happened was I jumped on it, and then I snapped my ankle. I literally heard a snap and a and there it was. And so I was like, oh man. And being that the person that I am, you'd think because I have anxiety that I'd be like, oh my God, I'm dying. But I kind of go through this weird thing where I kind of disassociate with my body, and I try to argue with myself, and I say, oh, it's not that bad. Like, or maybe it is that bad. I don't know. I haven't decided. And so I start walking around on it, and I'm like, oh, this hurts. But I'm like, not that bad. I get home and I'm like, oh my gosh, it's so terrible. And so it was terrible. It was a workman's comp. They were mad. Work never likes it if you hurt yourself at work. This was years ago. And but when I go in, and I'm in a lot of pain, everything's all swollen up. But because it's an extremity and stuff, the pain's a little bit different. It's a little more bearable than your core or your head. And the doctors are like offering me all this Vicodin and stuff. They're like, take this. And like, I mean, a lot, not like just like 15 pills, like, 30 pills. And I'm like, it's not that bad. I mean, the worst part was having x-rays and when they're twisting it around. And so then I'm like, okay. So I actually remember refusing it and said, I don't really need that. I need, I need X, Y, and Z, but I actually refused it. Some years later, I had a terrible infection, and it was an abscess tooth that went wild, and it turned out to be like cellulitis of the face, which is extremely painful. It's agonizing pain. And they were reluctant to give me any pain medication. And I'm like, the shift is insane. Like, the level of pain I was in there was ridiculous. And we don't really want, like, what is wrong with you guys? And so, like, this whole, oh my God, we're in an opioid crisis, everything's made it go to the other extreme. And so it's like, you can be legit, your face is on fire and you're in agony and you haven't slept for 4 days. And they're like, how about a Motrin? And then other times in the past, it was like I sprained my ankle really badly, and it was like, borderline, is it broken or not? And you guys wanted to be like, do you need some morphine? Like what is wrong with the shift? It's like, guys, you need to find a balance. And so that is my rant about the California flip out about opioids and nonsense. And I was just like, God, calm down. But then again, I don't have the euphoria thing that other people talk about. I'm still coughing. So that tube down my throat has kind of left me with like this throat scratch, and it's still like a week later, and I'm coughing. The fun thing about kidney stones is they don't say you shouldn't get morphine. Well, gallstones are also painful as well, but they're painful in a different way. Like passing a kidney stone, particularly for men, because they have the long urethra and a sensitive I think men just have a harder time passing kidney stones. It's bad. It's bad stuff. Bad news. I remember a guy at my work passed out in the bathroom because he was passing a kidney stone, and nobody knew, and he was just passed out on the ground, and it turns out he was like, I don't feel good, and he was keeping it to himself, and then he passed out. It's like, yeah, that's no joke. That's some painful stuff, dude. Yeah, it's crazy. So, that being said, I am alive. My brain is kind of coming online. I'm feeling better. I've got some really good supportive family and friends. And my doctor did a good job. Nurses are amazing and they're superheroes. The opioid crisis has people flipping out too much, in my opinion. And I don't know. I guess the moral of the story for me would be, if you have side pain, go to the doctor, because if that thing bursts or becomes infected or other things, necrotic, It's no joke. Oh yeah, 10 millimeter. Ugh. Yeah. Yeah, I had a gallstone that was like blocking my biliary duct, and that caused a lot of problems. They were like, we're going to blast it out. I'm like, okay, I don't know what you're blasting, but sure. Sure, bro. So my incisions are crazy because, like, I mentioned that I was stabbed. There are like 4 stab wounds. It's like 3 down the right side, boom, 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 and then 1 up your belly button area, and you just got stabified. And the one that hurts the most is the belly button area. There was a joke about that. I could keep the stones, but I declined. I thought that was kind of gross. Though I did make jokes and say that I was going to keep the stones and give them to Hannah. If I was given the stones, I would send them to Hannah because I think she'd appreciate it. If they're good quality, like calcium stones and not just cholesterol stones. But anyway, I'm happy that it was successful surgery. I'm thankful for prayers and support. I'm thankful that God has given us the ability to use our intellect to solve problems. I'm thankful for doctors that have had the tenacity and the personality and the boldness to become surgeons, because I think there's a certain amount of ego and boldness that has to come forth to be a surgeon, to be able to cut someone open and do things. And they're kind of like the Top Gun of hospitals in a way. It's like you got to have a certain kind of nerve to do that kind of job, I'd imagine. And I'm thankful for nurses for being such a good support and backbone, and man, they know all the tricks, like, of the human psyche, and the tricks of pain relief, and how to function and roll out of bed and get walking and moving and functional again. And so, like, yeah, I am very appreciative, and I'm on the mend, doing better. And I'm glad it wasn't something worse. And I'll be happy in about another week or so that I'll be able to get ready and go back to work. And start to slowly ease into a normal diet. However, I've enjoyed the weight loss. I've lost 15 pounds. So I will probably continue on this low-fat diet to some degree with some cheat days. So, no B17, no. But I do want to continue to lose weight, and I want to start adding more exercise, and yeah, I don't know. I got some resolutions out of this. I think coming out of this, I feel a little more committed to my health, and a little more committed to my mental wellness, and finding some balance. And so I'm determined to make this experience a good experience in the end. So anyway, I hope y'all are doing well. And for those that are disgusted by surgery, I tried to make it not gory, but I did want to tell the story because I think it's crazy. Like it's just the craziest experience ever. And I think anybody that's had surgery, it's kind of a big deal. It's like, whoa, what was all this? Wow. And so maybe you have a surgical experience and story to tell, and maybe yours didn't go smoothly, or maybe yours went awesome, or maybe yours came out with weird results, and it's like, oh, they went in for the appendix and they found this out. If you want to share a surgery story and you don't feel like it's going to dox you or make you too uncomfortable, you can definitely comment below. I actually am a nerd and think that this stuff's all kind of interesting. I've heard some surgery stories in Discord. I've made people run away because I'm totally all about it, and like, oh, that's crazy. They threw around your body part, and they did this and that and the other, and they just dug in, did that, and they found out this and that. And like, I've had people like run out of the room. Oh my gosh, it's disgusting, because I guess they really picture it or empathize too much, and I just kind of have a compartmentalized part of me that like I am empathetic, but at the same time, I'm totally like there's like a nerdtastic kind of side to me where I just think it's really interesting. So I am one of those people that watches all the medical dramas, and I watch actual operations. And before my operation, I watched the others and stuff like that. And it's kind of weird that I'm that way. And then also I have general anxiety disorder, because you'd think they'd conflict, but sometimes for me, being aware of situations makes me less anxious. And so the more confidence I can garner on the surgeon, the less I feel what ifs. The only what if I was really afraid of was going under the general anesthesia. But yeah, you watch too much horrible stuff, so they get grossed out. I know I should put trigger warning on this. Anyway, I'm on the mend, and I hope y'all are doing well. And Thirsty Theist will be picking up. Starting with Pew Review, actually, being number 21. We will celebrate his 21st birthday, and we'll get to know more of Pew. And so he'll be number 21 for me. I haven't really set a date because I didn't know how long it was for me to not feel cruddy, but I'm already starting to feel pretty with it. So I'll have to get in contact with him and see what works for him. And then, I just think there should be more positive stuff. I'm getting tired of the negative stuff, and maybe we just need more positive interaction or something. Anyway, I will talk to you folks later. I often hang out in Drag's Discord. So I might be in and out today. I did not bring my laptop to the location I'm at because sitting in a position to use my laptop hurt, so I will not be gaming today. So anyway, well, thank you, Nim. Thank you for your support and kindness, and I am going to be signing off. Goodbye.